Welcome back. Dr. Sharma joins us today. He specializes in surgery and bariatrics, specifically for people who are overweight and just cannot seem to lose the weight. He is with New Life Bariatric Associates. Dr. Sharma, thank you so much for coming in today.
Pleasure.
You know, the first goal for many people is just exercise, watch what you eat, calories in, calories out. But many times it goes a lot deeper than that for some patients, and those patients need surgery, and that's what you perform and that's what you offer. So thank you for being here. Tell us a little bit about your business.
Yeah, the bariatric surgery is performed for mainly two reasons. Okay. One is high BMI. BMI is a number which gives you an idea in the spectrum of disease where you stand.
That's body mass index.
Body mass index.
So you're higher the BMI, the
more weight
unhealthy.
you have.
Okay.
The normal BMI is less than 25. And we perform surgery anyone with BMI 35 or higher. And the second important reason why we perform surgery is associated medical conditions. And many of these are life-threatening. Diabetes, high blood pressure, high cholesterol, sleep apnea, fatty liver, reflux, the list goes on and on. So in order to cure those things, we perform the surgery.
Okay, and that's what you want to talk about today too, is not just getting the weight off, but it's the physiological well-being of your body and how much better your organs are. It's not just the fat, it's what it does to you internally that you mentioned is really why.
Yes, it's not a cosmetic surgery.
Right.
Weight loss is just a bonus, but curing these life-threatening medical conditions, for example, diabetes, blood pressure and high cholesterol, we call it metabolic syndrome, and it's continuously clogging the arteries to your heart, to your kidney, to your brain, subjecting you to the risk of complications like stroke, heart attack, or kidney failure. And we want to prevent this. And this surgery is done to make you healthier. Weight loss is just a bonus.
Okay, so in order to be a candidate, you need to have a body mass index of 35 or higher, you said. And then what would be the normal age? I mean, because there's grossly obese people even in their teens.
Yes, it's a very sensitive topic. I do perform adolescent bariatric surgery at Wolfson. We have to wait till they have the understanding so they can follow the guidelines. So usually we try treating by medical means, and if still the things are not under control and they develop medical conditions like diabetes, blood pressure, then they may be candidate for surgery. There is no upper limit for this surgery. I perform surgery at 75, 80. Now, 80 may be a healthy 80, or 40 may be too sick who's compared to 80. So if they do have weight problems, and let's say they want to get a hip replacement or knee replacement, and they're not going to get this replacement unless they lose weight. So we have different kinds of surgery offered based on medical conditions, the goal, and age. Okay,
and what I found is interesting is there's 4 different types of surgery that are commonly performed for people to lose weight. One of them is the lap band. I've done a couple stories on this before, and that's basically like a band that fits around your stomach to reduce the size of the stomach, so you get the feeling of being full when you don't eat as much as you normally do. The sleeve, I'm not sure how that one works. The gastric bypass, and then a procedure called the DS. So I'm guessing this, tell us a little bit about those.
Okay, I'll just quickly describe. Yes. The goal here is to restrict the size of the stomach. Now you can get this by implant which is called lap band, which is wrapped around the stomach, or you can do it by sleeve, in which we reduce the size of the stomach by almost 80% by using the stapler. So you have a stomach of smaller capacity, so smaller amount of food is required to create the sensation of fullness. Now, gastric bypass and duodenal switch works on 2 mechanisms. Besides making the stomach smaller, we create a channel by which the food flows in one channel and the digestive juice travels in the other channel without mixing, so there is less absorption of calories, and it gives rest to pancreas, thereby curing your diabetes. And so they have 2 components, working together.
Wow, so anybody that wants to find out about what type of surgery that you have should look at all those options. And you do a lot of surgeries. And so one of the questions that, you know, a lot of people have is how do you go about finding the right doctor and the right surgeon for something like this? And there is a method.
I think that's an excellent question. This has to be carefully considered because it's a lifelong commitment with the doctor and the practice once you go bariatric surgery. And you have to look at the practice or the program, what they offer. Do they have multidisciplinary approach? Do they have all the component, dietitian, exercise therapist, behavioral therapist, psychologist who can bring the change? Do they treat the patients with sensitivity? Because like you're saying, it's once you go through the surgery, then it's actually changing your lifestyle and being able to handle the things that you used to. And a lot of times people have an addiction. It could be an addiction to food. And so it's going about training yourself. All right, and we only have about 30 seconds left, but I want to know, does insurance cover this? Most of the insurance, they have the benefits for bariatric surgery. However, as the surgery is getting less and less invasive, we are able to do most of these surgeries in same day in outpatient center, and we have tried to cut down the cost by almost 50%. So it can be done. We have a self-payment plan and other things. So surgery should not be denied to anyone. Most people do have insurance. If not, don't be disappointed. Okay, Dr. Sharma, thank you so much. Dr. Sharma will be back again in a few weeks, and at that time you're going to be talking specifically about diabetes and other things that by managing your weight and having some of these procedures done, what the long-term benefits can be over the course of a lifetime. Thank you so much for coming in. Really appreciate it. Coming up next, the dream of owning your own home may be easier than you think. We're going to have details straight ahead. Plus, the Wolfson Children's Challenge kicks off this Saturday from 9 to 3. It's your chance to take part and help children in need. All the money raised will go to buy hospital equipment and support the endowment. If you'd like to take part, you can log on to wolfsonchildrenschallenge.org.